Hello everyone, how are you doing? I hope all of you are doing well. My name is Debopom Sanyal, and today I'm going to talk about what do you expect in the hospital after you went through the bypass surgery. So I'll just talk about the procedure. It differs a bit from hospital to hospital or country to country, maybe, but overall it remains the same. So what I went through was I had those pre-operative procedures done a day before day before the operation. So they'll conduct some some tests and ECGs, not ECGs, X-rays and all those stuff, some 2D echoes and all that, and then they will trim your body or trim your hair because of the operation. The entire body they'll do it, and then in the morning, according to the time. So for me, they took me in the morning, and when I went at the OT, you'd not really understand and recognize anything because it will be too much. Generally, it was too much for me because I didn't really understand what's going on. I just wanted to hug my family and that was it. But I knew that this is not the end. I'm going to come back and see them again. So I was emotional, and these emotions. That's something that is very common. People generally don't understand the emotions that we go through, patients, right? That's a different kind of emotion actually. Sometimes it's negative, sometimes it's positive, sometimes you feel overwhelming, sometimes you feel energetic, like okay, yes, I shall come back and make a difference. But this is a entire different tangent, right? I talk about that a bit more, maybe in different video about the emotions that you go through even during the operations. Before the operation and after the operation. It's very delicate subject, and we must take it very seriously. So then I went to the hospital, and I was awake for, I guess, some 10 to 15 minutes when they were doing some initial procedures and everything. And then obviously there was this general anesthesia, right? So yeah, and then obviously I can't remember anything, or I was not awake, and I had there was this quintuple bypass for me. There were 5 bypasses. So if you see somewhere CABG into 3, 4, 5, that means 5 bypasses. You have been given 5 bypasses or 3 bypasses or 4 bypasses. So what bypasses generally are that our coronary arteries were blocked due to arteriolysis, and the blood flow was very limited. The heart was not getting enough blood, and that's why all those problems started. So they would graft different arteries or veins from body naturally, and they will bypass the route of the blood flow to the heart, so that you get the adequate amount of blood flow which you require, right? So that's the bypass generally, right? I had this Bima bypass, or bilateral this intramammary arteries, Rima and Lima. So I didn't have a cut on my leg because there was no veins involved, no vein grafting, or no artery grafting from my hand. So it was all one cut where the Lima and Rima were harvested and grafted for me. So there were that's how these 5 bypasses came. And then obviously I woke up around, I believe it was night, the same day night. When I woke up, it was not waking up fully, but I could understand I'm in a room. I had that conscious mind to figure out this is an ICU. I could see people around. I could see nurses and moving around. They were taking care. They were coming and trying to talk to me, and for few minutes I didn't really understand what's the pain and everything. But then slowly I realized that there were tubes everywhere. The tubes were inside my mouth, my nose. Obviously the drainage tubes were there, but it was too much for me to understand because I couldn't see anything, right? I couldn't see the tubes in my body. I couldn't move much. All I could do is move this finger. I can remember I was just moving this finger and trying to, and I felt like I'm unable to breathe with the life support, right? Because it was a struggle, and I could hear some sounds, right? And those sounds felt like that you hear in old days clocks, right? So I thought like there is a clock somewhere in the hospital, and I was trying to count. Okay, what is the time? And later I found out those sounds were from different medical devices, and it was not a clock, obviously. So I couldn't figure out what was the time. But I in the next day morning it was a struggle entirely. I couldn't sleep. I literally couldn't sleep. And in the morning, the nurses kept saying that you will be inspected. They'll see, and then only they'll remove the tube. So in the morning they came and they asked me to move my hands, both of the hands and legs. That means it's fine, it seems. And then they removed that tube from mouth and nose. So that was the first achievement that they'll do in the first day after the operation. Next day after the operation, you are still in ICU. Right now, you can't really move, you can't really sit, you can't really walk at this point of time, because there are still tubes inside your body, the drainage tubes. We spoke about the tubes which were there in your mouth and nose, which they have extracted already. So you still have those drainage tubes. There will still be pain, and I felt pain because I don't know. I was unable to take breathing. My breathing wasn't normal, and I struggled a bit to breathe at the beginning. Maybe due to anxiety, maybe due to the stress, maybe whatever it is. I can't really tell you why, but I couldn't. It was a struggle at first, and the thing is, the pattern of breathing, right? It was I was unable to understand or unable to practice that normal pattern how we breathe generally, right? So it was very heavy breathing. So the same day the physiotherapist will come. Generally they would help you. They would help you to they'll do some they have a machine which they rub behind your back generally, and it will help you to cough. They'll encourage you to cough, because there will be cough inside your lung. I mean, it should not go and deposit in the lungs, and they will encourage you to cough and take those cough out from your body. That will help. So that's the second day. You don't walk generally on day one after the operation, because you still have the drainage tubes. If the drainage tubes are removed, then you can walk. Now then, the drainage tubes are generally in for to get those fluid out which was there during your operation. Maybe it is blood, maybe it is the other fluids that they use to clean and all that should come out of the body, and that's why these drainage tubes are there. There are generally 3 tubes that remains inside your body even after the operation. So let's go to the next day, that is your second day of the second day since after the operation. And this is the day where I still had this problem, I still had this pain. However, I was slowly getting into the pattern of breathing, and then in the morning they took out. They saw they have a limit actually, that how much fluid is coming out. If that goes that limit, if it is less than that limit, they will take your drainage tube out. So next day, the second day from the operation, they took the drainage tube out, and then it was like, okay, now I have to walk. So the physiotherapist, they came and helped me to walk, and you will start walking 2 minutes, 3 minutes, 1 minute, and you will be encouraged to sit on a chair rather than on your hospital bed. So that will give you strength, right? Because your breastbone is cut, remember, and that is the healing, most important healing that you're going through. Your heart is now fit and fine. The only problem that you have is now your the sternum, which needs to heal. It moves all the time because you are breathing, and it's like a broken or cut thing. It needs to heal, but at the same time it cannot be at rest because it's moving all the time, right? So you need to ensure that it doesn't move in other ways, right? So that's why you sit straight in the chair, and you spend a good amount of time sitting, staying active, walk a little, right? They will help you to walk at the beginning because you won't be able to do it all by yourself, right? And then slowly you'll gain the strength, right? And that will be your the entire day. So for me it was like I used to wake up by 5 or 4:30 or 5. Generally that was the time, 5. And then I would wake up and go and sit on the chair, right? And then I'll wait till 10 o'clock, almost 10 o'clock, when my wife used to come. Then I'd come and see her, and then when she would go, then I would again go back and take a little rest after lunch and all that. And then again in the evening I'll sit, right, on the chair. So around 8 hours, 6 to 7 hours I'll sit on the chair. Rest of the time I'll walk for 5 to 6 minutes, or 10-15 minutes, total 10-15 minutes on a day, right? On the second day I'm talking about 5 to 10 minutes. And then yeah, that was it. And then rest of the time sleeping, right? So they would encourage you to sleep less, not sleep less, but lie down, rest, and less, and sit on the chair more. And while lying down, you should, when you're sleeping, obviously you're sleeping, right? Rest is also very important. So that was it. And okay, for I don't know how much, if you are not from India, probably won't be able to connect in this sense, but I just share my experience about food and all that during this time. So generally they don't give you this chapatis initial time, because you have to first really pass the motion after the operation, and then only they'll give you the whole food. Before that they'll give you some healthy foods like that. On your appetite as well, the appetite would be less. You'll not really feel hungry, and you don't really have any taste, right? And it takes time to recover the taste and appetite as well. So don't stress too much about the food. Just think about how can you start moving. And the sooner you start moving, the better it is. The positive frame of mind is very important. Okay, by the way, I did not talk about one very crucial thing, that is your spirometry. Spirometry is very important, that you do from the day, from the day one, since you gain consciousness. We'll do the spirometry that will help you to increase your lungs capacity. So keep a, if your operation is planned, buy a spirometric device and you can practice. It's anyway helpful. So that's one thing, and you have to do it even after you come home. So that's something that you remain into for some time, right? So yeah, and I guess that's it. There are so many other things that you need to you would go through once you come out of the ICU, and come back to your home. But that's for something another day, another video. Thank you so much. Please share your experience so that we all can benefit from each other experiences as cardiac survivors. And I will see you soon. Thank you.